I'm here with epidemiologist Bonny Specker, who is going to give us an update about the last couple of weeks with COVID-19 in our region and the state, across the United States and in the world. And also today, she's going to talk about some stuff that is hot off the press related to COVID-19. Bonny, what do you have for us today?
Well, I thought it would be good to just go over some things that came out this morning quite early and a source for some really good information, and then some data updates. And the source that got this news from is called Stat News, and this is the website. You can find out, who puts this out and what's in it at this website. But these were sort of the 4 headlines that related to COVID. And I thought I would talk a little bit about them and then also tie it into some of the things that's happening in South Dakota. One thing they talked a lot about were this new variant, the Delta variant, and how it's more transmissible, making the importance of vaccines even bigger. And these are simply the titles of the 4 articles. It also mentions about the Biden administration buying the 500 million Pfizer doses to donate globally. And I'll mention that too when I talk about that Delta variant. And then the long haul COVID in children, and apparently the FDA's meeting today to discuss the pediatric vaccines. So this Delta variant, it's the B.1.617.2 variant, and it is more transmissible, and it is the most transmissible variant that they've seen so far. So it's more easily transmitted from person to person. There is some ability for this virus or this variant to get around the body's post-vaccine protection, but they're saying that people with the full regimen of especially the mRNA vaccines don't really need to be worried so much about this virus or this variant, and that it's the people who aren't vaccinated who should be concerned. But they go on to say that because it's so transmissible, you really need to get people vaccinated, and it's going to be a problem in the poorer countries and in the U.S., especially in states where the immunization rates have lagged behind. So that kind of leads into the Biden administration and what they're doing, whether or not we should be paying for it, or we would hope that the vaccine companies could maybe sell it to the government at cost or whatever, but it's important to get everyone in the world vaccinated, not just because we're good neighbors, but also because it prevents the development of these variants. So we need to minimize that possibility by getting people vaccinated. The other thing I just want to mention is it is really important to test contacts and symptomatic people right now. I think a lot of people have just put COVID back, like it's gone out of their minds. It's important to get people tested so that we can identify these variants and determine whether or not they're in our community. So the more transmissible variants like this Delta variant is deadlier because more people become infected, okay? So if if a lot of people are getting infected, the more people that are infected, the more that are going to be hospitalized, which means the more that are going to die. So just because a variant might not affect the case fatality rate, if it leads to more cases, that in of itself is going to lead to more deaths. Okay, so you have on one hand how transmissible it is, and on the other hand, you have how the case fatality or how virulent it is. There is some evidence out of the UK right now that that Delta variant does lead to a greater hospital, or might lead to a greater hospitalization rate. In the US, there's only 6% of the cases that have sequenced for variants have been shown to be the Delta variant. So it's not the predominant variant in the United States as of now. But it is something to keep an eye on, because in the countries where this variant is present, it's really taken off. The COVID vaccines are effective against it, especially the full course of the mRNA vaccine. And this is just the results of one study that came out. If you have one dose of the Pfizer vaccine, it's 33% effective in protecting against severe COVID for this Delta virus. But if you have 2 doses of the Pfizer, it's 88% effective. So it's important to get that full dose schedule of the mRNA vaccines. Now, as far as what's in South Dakota, these variants, this data in this graph are just the ones that are known to be in South Dakota right now. We can't calculate what percentage of cases these are, because we don't know how many actual samples were tested to come up with these numbers. Or at least that's not information that's posted on the dashboard. But the Alpha variant and the Beta variant both have been identified in Brookings County. That was a while ago. At least the Beta was a while ago. I'm not sure about the Alpha. But you can see that the Alpha one is the predominant one that seems to be in South Dakota. And we don't have any of the Delta as of now. One of the other articles that they talked about was this long COVID and how it can affect children. And there are numerous adult studies out there showing that 1 in 3 adults experience prolonged difficulties following infection from COVID. There are 2 pediatric studies, one out of the UK and one out of Italy, showing that 7 to 20% of children experience long-term difficulties following COVID. Most of those children are in their teens, so it does tend to be in the older ones. Although the author of the article said, well, when you're talking about young children, how can you really know whether or not they have difficulties? Like, are they aware enough to say, that like the fog brain, whether that, can a child recognize that? So there's some question of whether you can diagnose it in the younger children. This long COVID in pediatric cases is different from that multi-inflammatory syndrome that they reported early on, and that is still pretty rare, but this 7 to 20% is not rare. And this kind of brings us into the vaccines for children. Pfizer is now, and has been for several weeks, maybe even more than a month, approved for children aged 12 years and older. Moderna is expected to have trial results out this fall for children as young as 5 years of age. And Pfizer is starting trials for both infants and school-age children in the near future. And the FDA is actually meeting today to really come up with good recommendations on how many children need to be enrolled in these trials and the safety data that will be needed for pediatric approval. So as far as the weekly summary, these data are as of yesterday, June 9th, and the complete file is available on the City of Brookings website. And we are doing really well. Last week we had 5 cases. This past week we've had 1. The week before we had 5, and we are down into this minimal spread level, but the Department of Health still lists us as moderate because they update this every Monday, and it's based on the previous 2 weeks. So next Monday, we should be, if we keep having low numbers for the remainder of this week, we should be reclassified into the minimal spread, which is a great place to be. We want to be down there. So that's pretty exciting, with a total of 4,231 cases. As far as the state, there have been 124,314 cases. Last week we had 87 cases. The week before was 156, and you can see that this has continued to go down quite dramatically. Very nice curve. So hopefully we can remain down there indefinitely. Now, I usually give the hospitalization data for both Brookings County and the state in terms of how many new hospitalizations there were per day. This is showing the cumulative number, so this for the state. So this is the total number of people that have been hospitalized. And you can see the last 2 weeks, it's gone down, which doesn't make any sense, right? Because it's cumulative. It should always be higher than the week before or the same. It should never go down. But what happened is back here on May 26, we had 7,572 individuals that had been hospitalized. On 6/2, it was listed as 7,500. And yesterday it was 7,100. So the reason for this, I did talk to the Department of Health about this, and am waiting for some more information to help clarify it in my own mind. But a lot of this data was coming in very quickly. And I think some of it sounds like some of the counts originally prior to the end of May, they were counting multiple people. So if someone was hospitalized, discharged, and then readmitted, they were being counted twice. Well, you can't really do that if it's ever hospitalized. You only go into that pot once. So they've been trying to go through a lot of the hospitalization data and working on cleaning that up. And that's what's causing this decrease in the total number. For Brookings, we thought we were at 161 people that had been hospitalized. Now it's down at 146. So, I don't know if they're done cleaning that data or not. And because of this, it's hard to show how many, I can't calculate how many hospitalizations there were in the previous week, because the way I do that is subtract the total number this week from what was last week, or I take last week's. So it's, I end up with a negative, and you can't have a negative for the number that's hospitalized. So when this gets settled, we'll be able to start looking at hospitalization numbers again. As far as the deaths in South Dakota, we've had 2,023 deaths. This past week, we had 4 deaths. The week before, we had 15. So you can see that it's kind of bouncing around down here. Hopefully it stays down in this 4 range or less. And I wanted to show some of the vaccination data. This is for the counties with the 10 most populous cities. And Hughes has the highest vaccination rate, 51%. This is using the total population as the denominator, because that's what's important when we're talking about herd immunity. Pennington County has the lowest percent, only 34% of their population's vaccinated. Brookings is up here at 42%. It's the solid green line. So you can see when we started the pods, we really bumped up our percent of the population that was vaccinated. And we're now above the average for South Dakota. Still would be nice to get all of these counties, actually, including Brookings, higher than where it's sitting right now. But you can see that the demand for vaccines has kind of plateaued out in some of these counties. But if you look at the percent of the population receiving at least one vaccine, you know, we've been doing pretty good in all age groups except that 20 to 29 year age group, where we have a lower percent of the population that's vaccinated compared to the state data. But these other age groups are all looking good. You know, it would be nice to get everybody up here in the 70% range. So, but here especially in that 20 to 29 year. As far as the United States, there have been 34 million cases. Last week, there were 106,000 cases. I'm just going to round off to the nearest thousand. The week before, it was 189. So you can see that we're dropping, continuing to decline there. If you look at the deaths, there have been a total of 613,000, 2,616 deaths last year, and 5,000 compared to 5,228 deaths the week before. As far as the world, those cases are also dropping. Last week we had 2.8 million cases compared to 3.4 the week before. You can see it is also going down. That doesn't mean it's going down everywhere. There's certain countries that are hot spots. You know, India and Brazil were the hot spots back in here. Now we're seeing hot spots in Argentina is one of the countries. So things tend to pop up and then calm down. This is very odd data this week for deaths. And a lot of this is because the World Health Organization and the Worldometer, a country may like catch up with all of their death data at one time. And these deaths, there's a lot of deaths here, 263,000 reported in the previous week. I'm sorry, 187,000. And they're actually spread out over recent day or recent weeks. So these numbers should actually be kind of spread evenly back some. So this is kind of what they consider an anomaly, and it's just from managing databases from a lot of different countries. So this week has been looking really good, and I just want to remind people to be socially responsible and protect your neighbors. Get vaccinated, encourage your family and friends to get vaccinated, and also remember to get tested if you have symptoms or have been in contact with anyone with COVID. Hopefully you won't have been, and Brookings this past week, there's only 3 active cases, so you know, fingers crossed it stays that way the next couple weeks. Well, indefinitely.
Exactly. I think it's really wonderful to see numbers going down, but you're right. You know, if somebody's experiencing symptoms, contact your healthcare provider. I will include a link in the description of this video that shows all of the places in the Brookings area where you can get a vaccination when you're ready. It's there waiting for you. So make sure you visit that link and you can see the different available options for getting a vaccination. Also, I do want to remind individuals, even though we are only doing a video every 2 weeks now, that the numbers have been lower, the slides are still updated on the city's website every single week. So if you want to go look at those slides, they're available to you. Have a great week.